So we're in this osteotomy case. Here's our model, 3D reconstruction of the patient's distal lateral femur made with a CT. So this is an exact replica of her distal femur. There's our cutting block, which we first started with here, and then we went there. So it's pinned into position. There you can see our cutting guide, which we're gonna make our osteotomy through. It's pinned in here. So that's step one, getting the guides in the exact position for our osteotomy. We're gonna take a quick x-ray and then make our cut. Okay, so we can see we've created our osteotomy there. This is a little Christmas tree, a wedge that we're gonna wedge into the osteotomy and make sure it opens up. So I just place that where my cut is and gently mallet. There you can see the osteotomy opening up. So that's why it's called an opening wedge osteotomy. And then it opens up to correct the mechanical axis of the leg. We got our two lollipops, we call them in, one anteriorly, one posteriorly here. There you can really see the osteotomy. And that holds it in position and allows us to drill for our plate. Here's our plate. There you can see custom width of our osteotomy there. That's gonna fit into the osteotomy, and then we're gonna drill our holes. It's gonna hold the osteotomy in position. So that's gonna go on next here. Drill guides over the plate. This is the same drill for every hole. So I just go through all of these holes with my drill, holding the guide in place. And once that's done, we've created the holes through our plate with the plate in position. So next we're gonna put the screws in, and that's about it. What's cool about this is that all of our screws are predetermined based on the templating of this plan. So I just call out the letter of the screw here based on which one I want for the plate. We don't have to measure the screws, they're already measured to the exact length that we want. We're using locking screws distally to the osteotomy. Those are not bicortical. And then we're using bicortical screws in the proximal holes. So everything's all preset, predetermined, and the length of the screws are preset, so we know exactly what they are based on our custom drill as well. Okay, hands. Okay, so now we got a bone graft or osteotomy. So what we've done is we've taken bone marrow from the patient's pelvis. That's been spun down to develop bone marrow aspirate concentrate. So these are the mesenchymal stem cells. So we're gonna take some of these, and then this is bone substitute, so demineralized bone matrix. So what we do here is mix the patient's stem cells. You guys have a sprayer there for me? We're gonna mix the patient's own stem cells, bone marrow aspirate concentrate here, with the demineralized bone matrix. And this sort of creates this little putty that you see here. And this is what we're gonna use to fill in that osteotomy to develop new bone. You see that there. There you go, it's bone graft. Finally, combination of calcium sulfate, calcium phosphate bone cement. So that's gonna go into the osteotomy here with our applicator.